Hey, it's Dr. Bill with just the tip of urology school. Today we're going to tackle testosterone supplement. Testosterone supplement is advertised everywhere, medical journals and the lay public, social media. But we want to really understand why our patients are requesting it and why our patients need it. There's some great guidelines, again, in the AUA core curriculum. So all of those of you who have access to this website, please utilize it. Nurse practitioners, physician assistants who do not have access to this particular website, look at Campbell's Urology. Look at a lot of journals that outline testosterone replacement in sexual medicine. And as always, talk to your mentor, your urology MD, who can always back your play with additional information. When you're trying to process what's going on with uh, testosterone, remember that because of the media input and spin, there's a lot of disinformation. So your job is really to filter that out and try to undo the disinformation and lead your patient on the right path. And there's some basic knowledge that you need to know, and you also need to know that there's a lot of over-the-counter products. We don't know what's in them. They're not FDA regulated. So even though they're over the counter, they actually may have some testosterone in it that may impact laboratory values. So be aware of that. Also understand that there is abuse potential with this, and many of our patients may come with a history of steroid abuse from the gym or from school, from competitive sports, or for whatever reasons they need to justify the illicit use of testosterone. Look at the hypothalamic pituitary gonadal axis. There's a lot of diagrams and algorithms in all the literature we've talked about, certainly on the core curriculum. Understand the negative um, feedback aspect of testosterone, meaning that if we take exogenous testosterone through this HPG axis that I mentioned earlier, the the testicle will shut down its normal production because there are receptors that identify the amount of testosterone that's in the body, whether it's exogenously produced or exogenously um, administered. So endogenous is the stuff that your body makes. Exogenous is stuff that you give or patients receive. 90% of endogenous testosterone comes from the testicle, about 10% from the adrenal gland. And even though it's 10%, that does have an influence on overall hormonal response. So be aware of that. Understand that in men, after about the age of 40, we will identify about a 1% per year drop in testosterone levels, and understand the differences between free and bound testosterone. Look at serum uh, levels and constellation of complaints. Just don't treat patients by their serum levels. Understand that understand that everything, both issues are required to when you're supporting testosterone uh, and to try to determine whether you're doing patients any good. Understand that the time to get the lab values are by convention best done early in the morning before 10 o'clock. That's when your testosterone is naturally the highest. There are some papers out there that indicate if people are working during the night and their diurnal rhythms are off base because they're nighttime workers, that that may that levels actually maybe those levels actually may be higher in the evening. But I don't have a lot of data on that. And so I normally rely, by my convention, checking first morning labs before 10 o'clock in the morning. Look at some of the common signs and symptoms of low testosterone, and there are a number of nice tables listing this in the written material I've already identified. But decreased memory and decreasing critical thinking, depression, decreasing muscle mass and bone strength, and certainly sexual dysfunction are big issues. When you look at testosterone deficiency, try to get an understanding of whether it's primary or secondary decreased testosterone. Is the testicle itself, the factory for testosterone, impacted or is and causing a low testosterone, or is there something impacting the testis itself? Know that it's not only free testosterone or total testosterone, but we need to look at prolactin, LH, FSH, SHBG, estradiol, and DHEA, one of those sex hormones that come from the adrenal gland, and also understand that there are other factors that can impact testosterone levels, including diabetes. And we know that with improved testosterone levels, declining hemoglobin A1Cs can be enjoyed. Again, a lot of disinformation. Spend a fair amount of time to identify that disinformation in your particular patient, and do what you can to lead them on the right track. Otherwise, you're setting yourself up for some frustration, both on your part and on the patient's part. Even with some urologists, unfortunately, and many primary care physicians who do not treat patients routinely with testosterone will have some confusion on the disinformation. A lot of that has to do with cardiovascular health. They're appropriately dosed and supported testosterone will not impact us negatively from a cardiovascular point of view. Improved perfusion and cardiac output has been noted, and improved exercise tolerance has clearly been identified in those patients who enjoy appropriate testosterone supplement. Know that when we commonly see younger men with concerns of low testosterone, they may be of age where fertility issues are of a concern. You do not want to offer exogenous testosterone in those patients. There are other ways of treating, but remember the concept of negative feedback. If we give testosterone, exogenous testosterone, to this patient population, it turns the testis off. And the testes do two things. One is produce testosterone, but also produces sperm. And so we do see patients who have juiced in the gym, if you will, and they come to us with concerns of fertility. We scrutinize their history and identify this. And oftentimes when we do semen analyses, we see zero sperm. And we also see some of those drivers for increased testosterone, LH, luteinizing hormone, which I mentioned earlier, on the depressed or on the decline. Sometimes those are recoverable. Sometimes fertility is not. So it's something that you do not want to be making a mistake on, and certainly want to inform your patient. When you choose testosterone supplement, the big thing is just mentioned is the patient have concerns of fertility. If there are, there's utilization of medications that can stimulate the testis to improve testosterone supplement, and also potentially stimulate spermatogenesis. So that's a win-win. For those who are not concerned about fertility, probably historically the least expensive and most available are IM injection products. Those are my least favorite for a variety of reasons. The two big ones, the pharmacokinetics, the way they're absorbed, they're abrupt increases and decreases in serum testosterone, and that loses stability. And when we want to have testosterone elevation, we're really shooting for stability to assist in general health issues that we talked about, certainly sexual dysfunction. If after I inject and have a great response with my erections, and then a week or two later when the numbers are lowest and I find that my erection capability is declined, there's a tremendous amount of frustration. We want to also on IM injections, parenthetically, living in a dry, hot climate increases our risks for polycythemia or thickening of the blood. With IM injections, probably 65-66% of the time, we may see polycythemia even with appropriately dosed and scheduled testosterone. So for those doing it correctly, it becomes a management nightmare. There are a number of other routes we want to look at, all with their advantages and disadvantages, namely topical creams and subcutaneous pellets seem to have the least risk for polycythemia, and that's certainly a plus. We want to look at the delivery system, as just mentioned. We want to look at the potential for abuse, unfortunately, and it appears that the IM injections probably top on the list of potential abuse, especially if you choose to allow the patient to self-administer. In my practice, historically, I have not done that for medical legal concerns. So there are a lot of variations to the theme, if you will, with testosterone supplement. It does, for those patients who require testosterone, it is clearly a life changer. Don't be afraid of it. Learn about it. Follow these basic guidelines offered in this video. Remember, it's just a skeleton of information. Dive in deep to the other sources of information and develop a comfort level in offering this potentially wonderful intervention for those patients who need it. And again, this talk is focused on male testosterone supplement, but off formulation, those of us who are comfortable with testosterone supplement for general health, depression, and sexual satisfaction, know that women are certainly deserving of testosterone under certain conditions. So always keep that, always be aware of that. Dr. Bill with just the tip of urology school.